You know how sometimes you feel a niggle in your shoulder, but it just doesn't feel like it's just your shoulder.
Hmm.
Like maybe it's connected to that stiffness in your upper back or even that weird tension you sometimes get in your neck.
Yeah, absolutely. That interconnectedness is huge.
That's exactly what we're diving into today, this incredible web in your upper body.
Yeah,
We're talking thoracic spine, that mid-back area.
crucial for posture.
Right. And your clavicle, the collarbone and the scapula, that shoulder blade doing all the amazing work.
Hmm.
We're going to unpack how these parts, well, how they work together. And maybe more importantly, how imbalances, this idea that Japanese call yukigami,
Body asymmetry or imbalance.
exactly how that can cause ripple effects through the whole upper body system.
And the material you pulled together for this, it's fantastic. Gives us a really good look from different angles.
Yeah.
We've got studies looking at pain, right where the collarbone meets the breastbone, the SCJ, the sternoclavicular joint. Then there's stuff on the other end, the AC joint, where it hits the shoulder blade.
Right.
Plus research on how the scapula actually moves, comparing folks with and without shoulder pain.
That sounds key.
And tying it together, studies on spinal alignment, T1 specifically, and even how collarbone joint injuries after trauma can flag other issues.
So the plan is to really sort of connect those dots today.
Exactly. Show how it's one big dynamic system.
Okay, let's start right there. At that central point, the sternoclavicular joint, the SCJ, where the clavicle anchors.
Mm-hmm.
One study looked at SCJ pain that wasn't from a big injury, right?
Yeah.
What jumped out at you from that one?
What's really fascinating is how pain in that, well, relatively small joint can show up elsewhere, places you wouldn't immediately think of.
Like where?
Well, the study points out that, yeah, people often get tenderness, maybe swelling right there at the joint.
Makes sense.
But the pain can really spread. It might feel like it's in the front of your upper trap muscle or along the outer clavicle down into the front of the shoulder, or even creep up into your neck, maybe even the jaw.
The jaw, seriously.
Yeah. And this overlap, with pain maybe from the AC joint or even nerve stuff from the neck, that's a really big piece when we talk Yugami.
So that neck ache you're stretching might actually be starting way down near your chest bone.
It's definitely possible, something to consider.
Okay, so if you've got that kind of neck or shoulder pain, no obvious injury, might be worth thinking about the SCJ. What about diagnosing it? How did the study say doctors can figure it out?
They looked at a few things. A couple really stood out for a clinical exam, pressing right on the SCJ causing pain. Very strong indicator, like 93% sensitivity.
Pretty high.
But what I found really interesting was pain when someone actively tries to round their shoulders forward, that protraction movement.
Uh-huh.
That also had high sensitivity, 86%. You could almost, try that gently yourself if that triggers pain right there.
That's a big clue.
It really could be. And imaging-wise, CT scans were pretty good too.
Yeah.
Oh, and visible swelling right at the joint. Highly specific. If you see that, good chance the SCJ is involved.
Huh. So just that simple rounding the shoulders forward motion gives a pretty good hint. That's practical.
Very practical.
All right, let's move along the collarbone then to the other end, the acromioclavicular joint, ACJ. We had some info on injuries there. How does the AC joint fit into this whole body balance picture?
Well, AC joint injuries are definitely significant for Yugami because they're just so common. A frequent cause of shoulder pain, especially for athletes or after falls, that kind of trauma.
Right.
Any leftover pain, stiffness, or just altered movement after an AC injury, that can certainly throw off how you use your whole upper body, create imbalances.
Makes sense.
The material didn't dive deep into the specific grades of separation, but it really stressed the team approach needed for good management. Orthopods, PTs, radiologists, nurses, primary care.
Yeah, it takes a village sometimes.
It really does, especially for getting back to full function.
What about that recovery process? What do the sources say?
The timeline really shows how gradual it is. First 6 weeks or so, it's mainly about healing. Sling, ice, maybe some gentle elbow and wrist movement.
Protecting it.
Exactly. Then, weeks 6 to 12 usually start weaning off the sling, getting more active shoulder range of motion back, some light strengthening.
Right.
Then, after about 3 months, that's when the focus shifts to full motion, balance, proprioception, body awareness stuff.
Right.
And then that gradual return to activity could be 6 months, especially for athletes. The big point is good rehab is crucial to minimize those long-term issues that could feed into Yugami.
So definitely get it checked out properly if you think you've hurt your AC joint.
Absolutely. Don't want to risk lingering problems.
Okay, let's shift to the scapula now, the shoulder blade. Such a key player. We looked at a study comparing how it moves in people with chronic shoulder pain versus those without. This feels really central to Yugami in the upper body.
Oh, definitely. This is where we see some really interesting adaptations the body makes.
How so?
The study used motion tracking to see exactly how the scapula moved during different tasks, like reaching back, bringing a drink to your mouth. And they look at muscle activity too, EMG.
And what did they find in the group with pain?
They found noticeable changes both in the movement pattern and the muscle activation. Like during reaching back and drinking, they saw differences in upward rotation of the scapula and more winging.
Winging, where the edge of the blade sticks out.
Exactly, sticks out more from the ribs. That's something you might actually see as asymmetry, a visible sign of Yugami.
So even in everyday stuff, the body's adjusting when there's chronic pain. And it's not just the movement path, but which muscles are working.
Precisely. They found the middle part of the trap muscle was more active across all tasks in the pain group,
Interesting.
and the levator scapulae, that muscle that lifts the shoulder blade, working harder during loaded raises and most of the drinking task. The lower trap also kicked in more during drinking.
Okay, so some muscles working overtime, any working less.
Yes, the lower part of the serratus anterior, that's a really important one for holding the scapula flat on the ribs and rotating it upwards. It showed decreased activity during loaded lowering and drinking.
That sounds like a pretty significant shift in coordination. What about those muscle ratios the study mentioned? What were they telling us?
Think of them as balancing acts. They looked at the ratio between muscles pulling the scapula out versus in or up versus down.
Okay.
And in the pain group, these ratios were often different. Suggests an imbalance in how these opposing groups were working together. Like one ratio compared the middle and lower traps to the serratus anterior, if that ratio is higher.
Means the traps are working relatively harder than the serratus.
Exactly. And those kinds of imbalances can contribute to that altered movement and the whole Yugami picture.
So the body's trying, but maybe overcompensating with some muscles, underusing others, leading to imbalance. But what about the actual amount of movement? Did the scapula move less in the pain group?
This is where it gets really interesting. The study found the overall range of motion was actually pretty similar between the groups.
Huh. So same motion, but different muscle activity.
Yeah, which suggests the group with pain might be working much harder, using more energy to get that same movement done, like less efficient.
Right.
And they noted everyone in the pain group had visible scapular dyskinesis, that winging we talked about. Maybe that increased activity in the middle and lower traps is the body trying to stabilize things, maybe make up for that less active serratus or even other muscles like the rhomboids.
That paints a really clear picture of how chronic pain can lead to these subtle but really significant changes. Definitely a route to Yugami. We also had a quick mention of scapular position in athletes.
Yeah, briefly. One study looked at how far forward the scapula sits in overhead throwers versus others, using a specific measurement tool.
Trying to quantify posture.
Right. Didn't give specific Yugami findings in the excerpt, but it shows people are trying to measure this stuff. Another study just noted that scapular dyskinesis is pretty common in athletes, both overhead and not. Suggests even active people could have these imbalances, maybe from their sports demands.
Okay, let's move down a bit now to the thoracic spine, and specifically T1, right at the top where the neck meets the mid-back.
That crucial junction.
One study looked at the angle of T1, the T1 slope, and how it relates to overall spine alignment. Why is that T1 slope important?
T1 is that transition zone. The slope, basically the angle of the top of that T1 bone relative to horizontal, is getting recognized as really important for understanding your overall side view posture sagittal balance.
Okay.
The study looked at people with different T1 slopes and measured a bunch of other spinal and pelvic angles to see what was connected.
And what did they find? How does that one bone's angle influence the rest of the spine?
They found some strong links. T1 slope was significantly correlated with the thoracic kyphosis, that mid-back outward curve, with the sagittal vertical axis, basically how far forward your head is over your pelvis,
Okay.
and with the cervical lordosis, the inward mid curve. Specifically, a bigger mid-back curve, a more forward head, and a bigger neck curve were all linked to a steeper T1 slope.
So it's all connected. T1 angle influences the curves above and below.
Absolutely. It shows how thoracic alignment, starting right at T1, has this knock-on effect, a real component of spinal Yugami. The researchers felt T1 slope reflects the spine's ability to compensate for imbalances. When things are out of balance, T1 slope tends to go up.
And what helps prevent that steep slope?
They mentioned pelvic movement tilting it back, and the thoracic spine's own ability to compensate were key factors, especially in people with spinal deformities.
Fascinating. So the whole chain matters. Right. Lastly, we had a study looking at clavicular joint injuries, SCJ and ACJ, but in people with severe trauma.
Yeah, patients with really significant overall injuries, a high injury severity score.
What did that show?
Interestingly, those with these clavicular joint injuries were actually, on average, less severely injured overall compared to controls without those joint injuries. That was different from clavicle fractures.
Okay. A bit counterintuitive, maybe.
A little. But here's the key part for our Yugami and interconnectedness theme. Patients with these SCJ or ACJ dislocations were more likely to also have injuries in their chest and moderate injuries in their upper limbs.
Ah, so the joint injury flags associated problems nearby.
Exactly. It reinforces how an injury around the collarbone shoulder region can signal issues in the thorax or the rest of the arm, especially after major trauma, which can create complex Yugami patterns from multiple hits.
Understood. So it's an indicator for those specific associated injuries.
Right. They also mentioned things like motorbike accidents were common causes and that these joint injuries were less often operated on immediately in the severely injured, likely because life-threatening stuff took priority.
Makes sense.
But the main takeaway is that CJIs and trauma can be a red flag for other chest and arm injuries, really highlighting that regional interdependence.
This has been, wow, a really deep dive into how interconnected that whole upper body region is.
It really is complex, isn't it?
Yeah, seeing how the SCJ pain can spread so far,
Yeah.
how the scapula changes its whole muscle strategy with pain, how that T1 angle reflects the entire spinal balance.
Absolutely. And those key takeaways, like the simple shoulder protraction test for potential SCJ issues,
All right.
or understanding that even if shoulder motion looks okay in someone with pain, their muscles might be working way differently, inefficiently.
That compensation idea.
Yeah, and the T1 slope being linked to the neck curve, mid-back curve, head position. And finally, those clavicular joint injuries and trauma acting as signposts for other damage.
It really brings it home. So for everyone listening, maybe take a moment to think. Could that ache in your upper back be talking to your shoulder?
Mm-hmm.
Or could just, how you sit or stand day to day be creating subtle imbalances you haven't quite noticed yet?
It's worth paying attention to those connections in your own body.
Definitely. And if something feels persistently off, maybe getting a professional assessment that looks at the whole picture could be really beneficial.
That's a great final thought. Understanding these links isn't just for fixing problems, it's about awareness, promoting healthier movement, maybe even stopping issues before they start.
Well said. Thanks for unpacking all that research with us today.
My pleasure. Always fascinating stuff.
And thanks to all of you for joining us on this deep dive. Until next time, keep exploring the amazing complexity of your own body.